I'm Kelsey. I'm a second year student at Marian University in the CRNA program. Today I'm going to go over Msmaids with you guys. So this is to be done before the patient gets back, probably right after you do your come in the morning and do your machine check, which there's a separate video that Dr. Luke completed on that. So this is actually what I mentioned in the induction video for him to go over, but obviously this is something you want to do before the patient gets back. So Msmaids, it stands for machine. So that's what's included in your machine check, basically, that your machine's ready to go. Maybe you set your patient's weight, maybe you went ahead and put in how old they are. So the machine's ready to go. Second is S, so suction. You want to verify that your suction's working appropriately for when you need it. And then the second M is monitors. So you want to have your EKG ready to go. You want to have your temperature probe ready. You want to have your twitch monitor on hand. You want to have your SpO2 and your end-tidal CO2 line and ready to go. And then next is A, so that stands for Airway. So this is how I like to set up my table. You guys are going to have obviously different preferences and you'll find your way of doing things, but Dr. Luke likes us to have 2 blades. I use a Mac. Some people prefer a Miller, which is the straight blade. And then obviously you want your handle. You want to have 2 airways, so your oral airway in case you need it, and nasal. And then also tongue blade in case you need that to help insert your oral airway. And then you want to have 2 ET tubes sizes. Here I have a 7.5 and an 8. Obviously you want to have your syringe to inflate your balloon. I go ahead and get my bite block ready to go for emergence, like I did in the previous video. And then you always want to have an LMA. You don't have to have it out, obviously out of the package like this one necessarily, but at least you want to know where it's located in case you would need it. And then I like to have my tape ready to go. Tape ready to go. And then the D in Msmaids stands for drugs. So I go ahead and have my induction medications laid out. I say it's just a typical case. You might use fentanyl, lidocaine, propofol, and rocuronium. And then you also, depending on where you're at in the clinical setting, but you might want to have some emergency meds ready, obviously dependent on the setting, patient specific. So you might have epinephrine, you might have phenylephrine, Robenol, and succinylcholine in case you would need it. And then the S in Msmaids stands for safety. So it's just kind of a time to take a step back and think, will my case be safe for the patient? So, you've done your machine check, you verify that you have a bag, appropriate size mask in case you would need it, and that your oxygen is working and everything's ready to go. So yeah.